Hello, and thank you for joining us on LinkedIn Live for today's discussion about project management in healthcare IT. My name is Juliana, and I'm a marketing coordinator with HealthLink Advisors. I will be moderating today's discussion. Please note that while your audio may be muted, we encourage all questions to be submitted through the chat feature. We'd like to start with a quick introduction of our company. HealthLink Advisors is a boutique advisory firm with deep Big Four experience, a growth mindset, and a focus on culture. Their diverse team of industry leaders maximizes client value by applying bold strategies to drive positive change. The company focuses in the areas of clinical, business, IT consulting for healthcare provider and payer organizations. In the provider market, this includes a rapidly expanding base of health system clients across the US and globe, including academic medical centers to integrated delivery networks and community based hospitals. HealthLink Advisors is top ranked by class in the strategic HIT advisory segment. Before we jump into things, I wanted to introduce and provide a little bit of background on our speakers today, Liz Richard and Kevin Stolpelman. Liz is a vice president with HealthLink Advisors over the program and project management service line. She is a highly skilled, results oriented healthcare leader with over 20 years of experience driving complex business and technical initiatives. She excels in complex program and project management, healthcare IT advisory consulting, operational and clinical process improvement, and financial management and analysis. Liz holds a Bachelor of Science in Healthcare Administration from the University of Alabama. She also has a Master of Health Science and Master of Business Administration from the University of Florida. In addition, Liz is a certified project management professional. Next, I would like to introduce Kevin. Kevin serves as a director with HealthLink Advisors. He has extensive experience building and leading large scale strategic IT and business transformation initiatives and overseeing healthcare and PMO operations with project portfolios greater than 200 million. Known for exploring new ways to right size operations and drive business results. Kevin has a proven track record of partnering with senior executive leaders in strategic planning, development, and implementation of large scale programs, building and leading teams, and developing processes, policies, and standards that drive project delivery. He holds a Master of Business Administration and a Master of Science in Management from the University of Denver and is a certified project management professional. I will now pass it over to Liz to dive into our topic today.
Thanks, Juliana, and thanks everyone for being here with us this afternoon. Today we're going to talk about the value of project management in healthcare IT. We're going to talk about some of the solutions and challenges that organizations face, and we're also going to talk about some trends that we're seeing in healthcare IT project management. So Kevin, it's great to be here this afternoon to talk about something that's really near and dear to our hearts and something that we're really passionate about.
Hi, Liz. Yeah, it's great to be here with you. We've been doing this for a really long time and are both vocal proponents of strong project management within the healthcare IT organizations. We've definitely seen our fair share of good and bad projects out there, right? So, what we've seen for the most part is that project management in healthcare is not all that different from other industries. We see organizations stand up project management operations in various forms in an attempt to add value to the organization, right? And like many industries, the success of these efforts is really heavily influenced on company culture, leadership engagement, overall skills of the project resources involved, right? So I've been looking at some general industry research. I'm trying to find some different statistics out there. And what I found, just to give our listeners some context here, 89% of organizations have at least one PMO organization, with 50 having more than one, 50%, excuse me, having more than one. 64% of organizations have department-specific or regional or divisional PMOs, and 49% of those organizations have an enterprise-wide PMO. So while these are general industry statistics, what Liz, you and I have seen is that healthcare really aligns very well with these findings, right? So our interpretation then of these numbers is that companies do see value in project management, and more are driving that value through PMOs.
Yeah, those are great statistics, Kevin. And I think most healthcare organizations really do see value and recognize that value of project management, which hasn't always been the case. So when we articulate the value of project management, we think about how we'll be able to improve on the delivery of our strategically aligned initiatives, how we'll be able to more efficiently deliver our business outcomes, and then how we'll actually be able to reach that triple aim in project management, which is on time, in budget, within scope. And we know that project management helps us organize our work and really drive those projects to completion. It also helps us to effectively and efficiently utilize our resources and align our organizational communication around those initiatives. We also know that using these standard tools and processes really helps us deliver across the organization, the PMO, and even down to the individual department and project managers. And finally, the ability to improve customer satisfaction. So, PM Solutions actually just published their State of the PMO 2022. And what they found was that organizations reported a 61% improvement in being the number of projects that were delivered on budget and a 59% improvement in the number of projects that were delivered on time. And I think those stats really just underscore just how incredible project management is and how effective and how much value it produces. And so that's why we really need to continue to embrace project management and really to mature our PMOs.
Yeah, Liz, I totally agree with you. And based on these numbers, we know that healthcare organizations are generating value from project management, right? So, but what we've experienced is a little bit different, right? What we see that most healthcare PMOs are not really as mature as they could be at delivering that value. So, some additional statistics that I was able to find show that 87% of high performing managers believe mature delivery capabilities can minimize risks, control costs, and increase value. 56% of those companies, however, are dissatisfied with their current level of PM maturity, and only 46% of organizations make project management maturity a priority. So if all of these organizations say that project management maturity is really important, we need to understand kind of why they're not achieving these results. And so from our experience, I think our short answer to this is it's hard, right? It's hard to achieve and maintain high levels of maturity. There's a lot of organizational challenges. There's constant change, some of which the PMO has control over, some of it they don't. So, if we start to look at the areas where these groups are most challenged, I would say if I had to list them out, probably the number one item is going to be governance, right? So, and what do we mean by that? It's really a lack or ineffective overall executive governance over the PMO. We see some also at the project level, but really mostly we're talking about that executive governance. There's a lack of structure, defined roles, and really limited or lack of executive engagement, even. So it makes it really a challenge for organizations. Another area is people, right? There's an inability to hire and retain skilled program and project management staff. We see that their organizations are having really a difficult time dealing with the changing workplace dynamic. They're hiring and managing a remote staff, specifically after COVID-19. So they're just struggling with that. Another area would be project intake and prioritization. We see a lack of defined processes or maybe an inadequate process for the collection and analysis of information to determine if a project should be undertaken by the business. Right? We see high volumes of project requests with no requirements or no vetting from executive leaders prior to those requests coming in. We see projects not being evaluated on a consistent criteria. And what do we mean by that? It's really alignment with organizational or strategic objectives, evaluating on a return on investment, looking at the associated risks for whether a project should or should not be done at that point in time. And really, once a project does get approved through this process, there's inadequate or no project prioritization or staggering of projects once approved, right? Business owners assume that once a project is approved, that it's going to begin immediately, and that may not necessarily be the best solution for the organization itself. So, all of these things have kind of a downstream impact on project delivery. The organization then takes on too many projects within the cycle. And as a result of that, because they're taking these on, they're assigning these projects to limited project resources, right? So your PMs and your program managers now are getting overwhelmed. Instead of one or two projects that they have to monitor, they're monitoring 5, 6, or more. and it's really kind of diluting that value that they're trying to achieve. So those are some of the challenges that I have seen. Liz, what are some that you're seeing?
Yeah, so in addition to what you've already mentioned, we see challenges around processes and standards, and that really runs a full spectrum. It could be complete lack of documented processes and standards, so it's a free for all, and everyone's trying to recreate the wheel, and nothing is standardized. We see organizations who've actually documented the processes and standards, but then they don't follow them. And then we see the opposite end of the spectrum where, organizations have so many processes and standards that it becomes very bureaucratic and it becomes very difficult to actually execute and complete projects. Then when we look at project tools, and when I'm saying project tools, what I mean by that is your system, not your templates like your Excel templates or Word templates, but there are several things that are challenging in this area. Some of it's related to if you go out to select a new tool. So, and if you're selecting a new tool, many organizations, if they're doing that, they have some underlying issues and challenges, and they think that the tool is actually going to solve all their problems. And it's not. You really have to fix those underlying issues and challenges, and the tool is there to support you. Other ways that you have to think about and they experience challenges for that new tool is not documenting requirements. And if they are documenting requirements, many times they're actually just documenting those just for the PMO team and not necessarily for your executive leaders or for your other business stakeholders. And then finally, not completing a selection process for that tool. So a very rigorous process of going out and looking at a market scan, perhaps issuing an RFI or RFP, evaluating that, coming up with demos and looking at the tools, and then finally doing those client references. So those are challenges faced if you're looking at a new tool. If you've got a tool, and some challenges that organizations face are around putting together standards and processes around the tool. So when do you need your information input by? Where are you putting information in the system so that everybody's doing it consistently? Another area that we see challenges in is compliance and quality. And so even if we have the standards and processes in place, are we conducting a compliance and quality check to understand if people are actually following those standards? Are they looking at things appropriately and putting things in the appropriate places where we are expecting them to document? And are we doing audits or quality checks on those to ensure that we've got the right processes in place? And then the final area I'll touch on is customer satisfaction. And when we look at customer satisfaction, we don't see many organizations doing that, whether this is part of a larger IT survey or it's specific to the PMO, but there's really no gathering of formal or informal feedback, and there's no measuring consistently over time, and then not using that feedback to input in a feedback and a performance improvement loop. So we do see lots of challenges in organizations, and it really depends on what you're seeing organization to organization. They vary and they differ, but also on that maturity level of the PMO.
Yeah, Liz, I agree. And that's a huge list of challenges, right? So the good news is that, most PMOs don't need to solve all these issues at once, right? So to be successful in the long run, organizations really need to embrace that continuous improvement mentality. And we recommend that, otherwise they risk being kind of pushed aside by the leadership in the organization itself, right? If they don't mature, if they don't improve, then they definitely get left behind. So now that we've talked about many of these challenges, let's talk about how organizations should address some of these. Right? I don't think we've had enough time to really cover all of these because that list is pretty extensive. So let's pick a few of the top ones that we see. So let's start with executive governance. Right? As I mentioned, we've seen organizations struggle with lack of governance or ineffective governance. So Liz, tell us a little bit, about some of the steps that healthcare organizations are taking to make improvements in these areas.
Yes, governance is just so incredibly important to the PMO and our PMO processes. So it's really important to start and look at, what is our desired future state? And typically what we want to see from a governing body is we want to see project prioritization. We want to see project approval. We want to know if the governing group is actually going to be responsible for. They want to remove roadblocks and also to be an escalation point if the project is at risk. Um, Typically, we'll see some of our large, complex projects and those with a high risk have checkout points and check in points with this governing body. And also, this governing group will likely want to approve scope and budget and time changes. So once you get to that desired future state, then you can really look at your current state. So what does your current governing body look like? What is its role? Who makes up the governing body and are they effective? Do we have the right people in place? And then what are the current challenges that we're experiencing? So once we've got desired future state and we've got current state, then we look to performing a gap analysis and putting that roadmap in place. And once we start to look at that roadmap, we really want to get buy-in from executives. We want to start to identify that executive sponsor, executive chair, and we also want to develop a communication plan for the various stakeholders at our organization. In addition to the executive leader, we want to make sure that person has support so they can help drive this process forward. So, someone that can help them organize the material and develop pre reads, and also to make sure things are scheduled, action items are taken, and we can really make sure that we're making progress. And then finally, once we've got this up and running in a future state, then what we really want to do is make sure, again, check in. How are things going? Are we experiencing new challenges that we need to address? And again, put in that feedback loop for performance improvement. So, but governance is really one of the most important things that we can have here. So that's one of the challenges and solutions. Kevin, which one would you like to cover?
Let's talk about resourcing, right? So we've seen challenges in filling open or new positions for many years, right? That's nothing new, but it's really become more critical given the current market conditions, especially post COVID-19. Finding the right candidates with the right skills and retaining those resources has become extremely important. What we've seen work with organizations trying to improve their resourcing is really a focus on the fundamentals, right? So there's nothing surprising out of a lot of this. It's really basic HR 101 type things that the organizations really need to get good at. We if we start to look at those, some of the recommendations we would have is, again, to get clear, I guess, clearly define the role that you're really looking for out there, right? Define the skills and the experience levels needed within the organization, along with any certifications that you might be looking for. Within project management operations, there's technical certifications. There might be PM certifications. Within healthcare, there's clinical certifications, right, that you might be looking for to apply to a specific project or program out there. So make sure you're defining that skill and experience that you're really looking for. The second step would be to ensure that the job posting reflects that experience, right? So a lot of times you spend a lot of time defining the role only to post the job out there, and it's looking for very generic project management or project type of resources. You may not necessarily find what you're looking for that way, right? You're going to get a huge amount of resumes coming in, and you're going to have to sort through all of those. So the volume is an issue if you don't do this very well. The other extreme is if you put too much information, you're kind of looking for a needle in a haystack, and you may not get resumes at all, right? Because you're saying, I really need this criteria, and unless you have years and years of experience or very specific healthcare experience, you may not find that person. So, once you have this defined, once you've got your job posting, make sure you're working with HR to work through the pay scale on that, right? So, again, if you're looking for something that's very specific, you might see higher pay or need to pay more for those resources versus maybe more generic type skills. So, really work with HR to level set that and appropriately gauge kind of what that resource is going to be needing. Other than that, I say within the definition, determine other operational expectations or experiences that you're looking for, right? If from an expectation perspective, is that resource going to be needed to work in house they going to be remote? How many, what's the work hours look like? What are collaboration experiences or expectations? So some of the things that you'll be wanting to look for that may not necessarily be identified within that job description. So, once you've got it documented, then you get to interviewing. So develop a standard list of interview questions for the role. And really what you're trying to do here is to get at what are those must-have qualities that you're looking for from a candidate, and make sure that your questions align with trying to gauge that information to find out if that candidate has those qualities that you're looking for. Again, whether those are technical, business, general PM, maybe clinical skills, you really want to customize those to each of your candidates. So another thing that we talk about in interviewing is interviewing more with more than one resource, right? So have a team of individuals, or at least a few individuals, that are helping you in the interview process. You're getting different viewpoints on the skill set and the capabilities of the candidate, and you can also kind of discuss the good and the bad points of those candidates with others, rather than just kind of relying on that for yourself. The one area where we would say make sure that or we caution you with, is that you don't want to interview too or bring in too many people and interview too much, right? We've all seen cases where we just have this huge amount of interview schedules for these candidates, and they go days and days doing more and more interviews, and it's really hard to get a consensus on a candidate if you have a lot of people and a lot of different interviewing going on out there. So you really want to kind of make sure that you're balancing that appropriately. Um, One of the things that we talk about in the interview process too is really be ready to communicate non-monetary advantages of the organization, right? Most of the time, HR will cover things like benefits during the hiring process, but you want to be aware of what those are, because the candidates are going to ask. Make sure you also bring up the culture of the organization. Are they going to be a good fit for your organization? You can kind of gauge that, and then they'll also want to know if they're going to be a good fit, or if the culture is going to be a good fit for them. And then the last thing I would say is really have that career path outlined for the candidates, right? They're obviously going to want to know this stuff, and they want to know how to grow and really progress within the organization, especially given now a lot of candidates really are looking at opportunities to do more. And we've seen that more and more with candidates as we're interviewing them. So make sure that they understand kind of that progression. So again, these are really fundamental. Nothing surprising here, but Liz, I know there's some others out there that I'm probably forgetting. What are some of the things that you're seeing healthcare organizations implement?
Yeah, so you've outlined some really great foundational resource things that folks can do, but it's a really tough labor market, and I know that everyone's having trouble finding resources. So we're seeing some organizations do something a little different. I was going to mention this briefly here and then talk about it later when we talk about trends, but I'm actually going to just dive right in right now. So one of the things that we're seeing is virtual project management. And so this is actually a supplement to the to your team, and basically, you work with a virtual project management or VPM service provider, and they provide resources at various skill levels based on your project needs. And this allows you to staff up or scale back as your demand fluctuates. And the resources are onboarded, they're integrated into your PMO, and then you contract for a level of PMO service or for VPM service, and that could be a half FTE, it could be 5 FTEs. And then your PMO leader actually works with the PMO or VPM managed service provider, and they basically work and look at your upcoming demand, what projects are fluctuating, and then you're able to adjust as needed. So that's virtual project management. The other thing that we're seeing is PMO managed service. And this is actually where you're outsourcing your PMO. And we're seeing this in not just PMO, but we're seeing it in entire IT organizations. And we're seeing it for help desk. It really runs the gamut. So it's no surprise that we're seeing this in PMO as well. Um, so some organizations are looking to do this programmatically. So maybe you have a specific large program that you need to bring in a program manager and 4 project managers, and so you're going to outsource that program. And others are looking to do it for their entire PMO. And this actually works pretty well for organizations that are struggling with their PMO. Maybe they're not being effectively delivering the projects. Maybe they're not mature enough. There are a lot of challenges. You can outsource your PMO, have someone come in, set it up, get it running effectively and efficiently, and then you're really integrating that into your team so it's seamless to your stakeholders. A couple things to think about if you're going to go out and do a managed service agreement. You definitely want the scope clearly defined. You want to be able to look at what's in scope, what's out of scope. You want to be able to define SLAs and report on those regularly. You've got to make sure that you're using a managed service provider that's very trusted and that they're going to work with you and be side by side with you as you do this. And then another thing to consider, and what we're seeing some organizations thinking about, is some organizations are actually thinking this is a long term solution, whereas others are thinking this is more of a midterm solution. I've got a struggling PMO. I want someone to come in, stand up a really great PMO, and get it up and running for 3, 4, 5 years, and then I'll take it back in house. So it kind of runs the gamut. But those are a couple of the resourcing solutions that we're seeing that are a little bit out of the box outside of those foundational levels. I think that really pretty much covers it for resourcing. So let's dive into solutions related to processes and standards. We mentioned when we were talking about just the challenges that this really does run the gamut of folks not having any processes and standards versus those having maybe way too many processes and standards, and it's very difficult to get things done. And what we really see is this really is it tracks very well with the maturity of the PMO. So with immature PMOs, we see no or little standards. So typically what we recommend is we see you going in and looking at those very important processes and standing up processes and standards around those. So, project initiation and kickoff, project checklist, status reports. You want to look at your meeting agenda and minutes to report out, your raid logs, your closeout checklist. And then once you're able to get a small list of those processes and standards in place, then you're able to get these up and running. And you want to make sure that you're setting expectations with your PMO staff on how these will be used and when they will be used. So in more mature PMOs, typically you're going to have some standards and process, and here's where you want to expand those. And this is where you might expand into a PMO playbook or other more complex tools and templates and standards. But then the other thing that you want to start to look at is, now that we have these processes and standards, are we actually using them, and are we using them appropriately? So implementing those quality compliance audit to understand, are we using the right tools? Are we using them appropriately? Do we have anything missing? Do we have some non-compliance where we need training or retraining on these? And then are we storing our documentation in the appropriate place so when we go back and we do a similar project, we're able to access those? And then finally, implementing a formal and informal feedback process with our stakeholders who are outside the PMO. And then finally, when we get to a mature PMO, this is where we again want to see some really looking at more complex things. So we want to see our organizations start to look at right sizing our project management approach. So for small, simple projects, we might want to look at project light, whereas for large, complex projects, we want to look at the full blown project management. And then also standards and processes as around some of the complex resourcing and scheduling related to the projects that we look at throughout the year. But in order for our PMO to really consistently deliver projects across the organization and to deliver them effectively for each and every project manager, we really do have to have these processes and standards in place. So let's pick one final solution to dive into. Kevin, what would be your preference?
I think let's talk about project intake and prioritization. I think that's a good topic to discuss, right? It's critical because it sets up the foundation for what projects will be taken on by the organization and which projects are going to be implemented first. So it's really important upfront to make sure and ensure that the process itself is clearly defined and communicated out in the organization, right? So many times we see or hear of managers or executives, they don't even know how to submit a project to a project management organization. So it's really important that we communicate that broadly within the organization. And so some things that as you're defining this process and communicating it out, some things that we would really recommend organizations take into account is first off, define or determine what is and is not a project, right? Define, thresholds for when a project or when a request really becomes a project. And what I mean by that is, be looking at, there might be a threshold for a dollar amount, or something in size in terms of hours and complexity that you're really talking about, right? Because otherwise, some of those requests may be better handled either through normal business teams or some of the IT standard operations groups, right? It's not necessarily a project. Um, when we do get the request in, we want to be clear with the information that we're really asking for, right? So, what is the project? First off, right? Why does it need to be undertaken? What impacts is it going to have on operation systems, people? Um, a lot of times you'll be asking for a business case. If that is available, upfront, great. A lot of times project management organizations help their customers, with that development of a project proposal or business case. So they work on things like trying to come up with estimated costs and estimated effort, and that's going to help drive a lot of that business case. But if it's available, you definitely want that information to be collected. You might also look at other things within the organization itself, right? Things like organizational strategic objectives. How does that project going to align with that? Or maybe risk issues again. Um, and overall, really, you want to know when that project needs to take place. Does it have to happen now? Is it more of a security risk, a regulatory type of a thing, just critical to the alignment and moving forward with strategies, or is it something that is nice to have that maybe can move forward a little bit later, given maybe resource or financial constraints? So, and when this information does come in, what we recommend is really a limit on who can submit that project request. We've all seen organizations where they open it up to the entire organization, and you get flooded with project requests. Everybody has something that they want to get done, and it takes time and effort to review each of those and come up with the business cases and all of the data that's needed to evaluate these projects. So really what you want to do is limit who can request projects, and you want to limit those to either managers or executive staff, those that have maybe a better view into the financials of the organization, or the resource capacity of the organization. Every organization out there has an annual budget that they're working with, right? And as we've seen in healthcare, the finance and accounting teams usually get together once a year for their annual planning. They really want to know kind of what the projects are, in one shot. So, trying to open those floodgates up when you have so many different projects out there is really difficult. So again, kind of limiting the numbers and having the executives kind of review for any constraints on financials or resources is really our recommendation. Um, Once projects are approved, right, once they're evaluated and approved, we would say, make sure you're implementing a prioritization process. And to start that, make sure that you have an agreed upon consistent criteria for how you're going to prioritize these. Again, things like alignment to strategy, return on investment is a good way to stratify the information. Risk to the organization, in whether you're going to do the project or not do the project, is another couple of good criteria to utilize. And really, what you're trying to do is evaluate all of these requests equally so that you can come up with a one to end type of a prioritization. And really, the advantage of that then is as the organization moves forward, if there is a constraint, whether it's financials or resources, you can draw the line easily on which projects are going to get done and which ones are not. And then once you've got all of this, the last thing that we would recommend out of the process is make sure you're communicating the status of all of these requests, right? We want to make sure that your customers know where their requests are in the process, whether things are going to get approved or whether they got denied, and if so, why. So just make sure that you're really clear with your customers and the organization in general, on where a lot of this stuff is at.
Great, Kevin. Thank you. So now that we've talked about challenges and solutions, let's transition to some of the other trends that we're seeing in IT project management. We've talked about virtual project management and PMO managed services. So let's talk a little bit about Agile.
So, excuse me, Agile, it's not necessarily a new trend, right? Agile's been around for a long time. Um, what we're seeing though is a trend for within healthcare that more and more organizations are utilizing Agile. And so, what do we mean by that? It's really in the area that Agile methodology, right, or the implementation methodology around project delivery. So they're implementing Agile really to assist in the ability of the organization to respond to disruptions, respond to change, improve quality, productivity, accountability, collaboration, all of that within that project delivery space. It's all being added around value, right? That's kind of the intent. And you're really trying to drive that value by utilizing this methodology. So, again, Liz, I was taking a look at some statistics out there, and I realize these are general industry statistics, but as we mentioned, right, healthcare does align with them fairly well. So, but 71% of companies are using Agile project management methodology more frequently than in previous years, and we're really starting to see that, clearly in healthcare. A lot of different organizations are implementing it. The interesting thing that I've found in some of these numbers, 85% of companies are using daily stand-ups. 81% of companies utilize retrospectives. 79% use sprint planning. 77 are using sprint reviews. So, the variation there, what it's really telling us is that organizations aren't implementing a full-blown agile methodology within their organization. They're implementing components of it. And they're doing that because, again, those components are adding value to their delivery process. And they're kind of walking away from or not implementing the full-blown methodology because either it's not adding value or it's just adding a lot of overhead that they really don't want. So, areas where we've really seen Agile being implemented within healthcare, definitely within the IT organization, right around the digital transformation teams. We see it around existing application teams, where, they might have an existing application where they're doing updates and enhancements. Agile really works well for keeping those programs moving forward. And it's almost like a no-brainer on this, right? Agile was developed around software development anyway. So within healthcare, it's no wonder that it really aligns with those specific areas. So some of the challenges, though, that we've seen in healthcare is really kind of twofold, right? So one is organizational structure. We see that, in healthcare, project management and really project delivery has really focused around a lot around um, waterfall type methodology. So around program and project management resources. So now that you're moving more into an agile methodology, you're introducing product owners, scrum masters, those type of roles. So it's really kind of getting comfortable with that, getting comfortable with the tools, getting comfortable with how does all that fit together within a PMO organization. And organizations are really struggling with that one. Another area where they struggle is aligning with other parts of the organization, maybe outside of project management. An example would be finance. Again, I mentioned finance and accounting tend to plan a yearly cycle or plan on a yearly cycle, and they want to know the full depth and breadth of all of the projects that they're going to be doing out there. So they want to make sure that they have that information up front, and that's not the easiest thing to do when you're trying to implement more in an agile way where things are developing as you go forward. So the one thing that we really tell our organizations that we work with to keep in mind is that projects in healthcare are really they're funded and approved based on what it is, what value does it bring to the organization, when is the project going to be delivered, and what is it going to cost. How it's delivered. It's usually not an initial consideration from executive leadership when that initiative is introduced. So you really need to make sure that if you are applying agile methodology, you're tying that back to the value of the organization and having to or helping to improve project delivery.
Yeah, that's great, Kevin. That's definitely a trend that we're seeing with organizations, at least taking pieces of Agile or in specific areas. So I think that's actually all we had for the main agenda. So let's take a look and see if we have any questions from the audience. So it looks like we've got one. How do you know your PMO and processes are mature enough?
So customer feedback is a primary indicator. Right? They'll let you know whether things are going well or not. But when you are going back to your customers, you're getting that feedback. Hopefully it's more in a formal survey type thing. Really, what you want to collect is net promoter scores, right? And really, it's how likely is that customer going to be to recommend services. So the higher that number, obviously, the more your customers value the services that you're providing, and hopefully along with that you're going to see increased demand for services along the way. So, you know, be mindful, though, that, when we talk about maturing processes and mature enough, the PMOs need to be flexible, right? Not every project has to have, every I dotted, T crossed for every component or every template used out there, right? So you want to make sure that you're right sizing to your methodology to the project level, but build that flexibility in, and that's really where that maturity comes in. It's building the flexibility to be able to handle different size projects with different components of your operations.
Yeah, and I would also say, Kevin, that when you're consistently delivering your projects on time, within budget, and within scope, I think that's another just basic indicator that your PMO and your processes are mature enough.
Yeah, yeah.
So it looks like we have one more.
Question.
How
Yeah.
many?
Oh, sorry.
Do
Do you
you
want
want
to
to
read
take
it or
that?
would you like me to?
You go ahead.
Okay. So, how many healthcare organizations are implementing Agile?
Yeah, so the we've got a lot of stats out there and a lot of numbers from different sources, good sources, but many of them aren't industry specific. So, you know, we know that organizations are approaching, agile a little bit differently. I think from what we've seen, we see most of our healthcare organizations are looking at or have already implemented some form of agile, and we've seen that work well in specific areas, specifically digital and innovation are a couple of areas that we see a specific team will go ahead and adopt agile more fully. And then we'll also see organizations adopting tools of agile, so they'll do daily stand-ups for specific projects, so almost getting to more of a hybrid agile. What else would you say, Kevin?
Yeah, I would, again, if you look at those industry numbers, roughly 65% of organizations are using Agile. But yeah, I would agree with you. I think, they're implementing components of it. So, they're implementing daily stand-ups or different components of it. A lot of Kanban type components from different areas. So they're not implementing that full methodology. And so, I think that's going to continue as far as a trend. I don't think they're going to implement fully. I think it will become definitely more of a hybrid, some of an implementation. So,
Well, it looks like we've got one last audience question, and it's how do you establish importance of PMO in healthcare organization where products are sold and not process, and plans.
Trying to understand the
So I
question
think,
here.
yeah, I think establishing the importance of PMO, whether it's products or whether it's services, really, I think you're looking at you've got to have that executive buy-in for the PMO, and really communicating out, what is the value of the PMO and how is it going to benefit the organization. So there's a lot of communication,
Right.
there's feedback loops, but it's really doing some internal selling to ensure that folks know what the PMO is, what are the expectations of the PMO versus the stakeholders, and then really starting to deliver value from that PMO. So folks really want to come back and say, gosh, I really need a PM on this project to make it successful. So I think that's what would be great as far as how you establish that importance.
Yeah, and I would, add, I would say take a look at, it depends on how those PM resources are going to be used or those PMO resources are going to be utilized, right? Are they helping develop those products? Are they helping on the sales side of the product? Are they helping develop that organizational kind of structure? I think if you can define sort of what the PMO is needing to do, then you can start to drive that value clearer in the organization as well.
Yeah, I would agree, Kevin.
Okay.
Well, great. Well, we really appreciate all the folks that joined us this afternoon for LinkedIn Live. If you think of any questions afterwards, please feel free to reach out to Kevin or myself, and I'll turn it back over to Juliana.
Thanks, Liz. Thank you to all our attendees for taking time to join us today, and we hope you found value in the conversation. This event will be available to stream on LinkedIn for future reference. If you have any questions about your project management strategy, please feel free to reach out to one of our speakers, and you'll see contact info on your screens for that. Continue following us on LinkedIn and join us on our other social channels as we publish future LinkedIn Live event information. We look forward to bringing you meaningful topics and discussions that are relevant in today's market. Again, thank you for being here, and we hope to see you all soon and have a great rest of your afternoon.